As a telehealth provider in 2023, are you prepared for the changes coming your way? That's right, telehealth is changing in 2023, and if you're a provider who offers these services, how are you preparing? If you're not prepared, well, here are some suggestions how to future-proof your business. First, the end of the public health emergency is causing a lot of changes. The public health emergency was great because it helped save lives during the pandemic. The government created it to help increase access to healthcare with the help of telehealth and other digital health tools. The public health emergency allowed telehealth to flourish. In fact, the Government Accountability Office, or GAO, found that the number of telehealth services increased dramatically from 2.1 million the year prior to over 32.5 million in the 12 months from March 2020 to February 2021. That was a 15x increase. The public health emergency ended officially on May 11th of 2023. And with it, we saw some changes that have affected telehealth availability. For example, if an individual receives routine home care via telehealth under the hospice benefit, this flexibility would end at the end of the public health emergency, or PHE. So, when you're faced with these rule changes, how can you move forward in business? Well, I suggest this. Don't ignore the changes, embrace them. So what do I mean? Well, let me tell you a story. When I was in school and taking math classes, a lot of my teachers allowed us to take calculators to use for our tests. And guess what? I used those calculators great. I used to ace those tests, get A's. I would simply put the numbers in the formula that I had memorized, and then like magic, I had the answer to write down for the test. But then I got into trigonometry, and my teacher, Dr. Wells, she was not having any of that. We had to memorize all the formulas we needed, and in real time do the calculations on the exam. At that level of math, there are so many steps in the calculations that if you messed up in step one, you'll be totally off and not get that problem right. Since ignoring the new rule by the teacher potentially meant I would fail the class, this was not an option. So I had to embrace this change. After understanding the new rules, I realized there were only 4 equations that I really need to memorize. Next, I had to understand all the different steps that need to occur so I can get the correct answer. And the only way I could do that was if I did a ton of problems. So with the help of a lot of work and embracing this change, I ended up getting a B+ in that class. And I learned a valuable lesson. You have to go through the change and embrace it fully. So if you're a medical provider, even with the changes in public health emergency, there are opportunities if you fully embrace this. With deeper research, I found for you there are waivers that were included as provisions of the Consolidated Appropriations Act of 2023, which has extended many of these telehealth flexibilities through December 31st, 2024. For example, people with Medicare can access telehealth services in any geographic area in the United States, as opposed to just in rural areas. So that's going to be extended now. People with Medicare can stay in their homes for telehealth visits. That Medicare now pays for that, as opposed to traveling to a healthcare facility. So that's going to be extended to 2024. And finally, certain telehealth visits can be delivered using audio-only technology, such as a telephone, if someone is unable to use both audio and video, such as a smartphone or computer. So this is a great news. If you do further research, you can find opportunities. But now is the time to take advantage of this time to begin the next phase of your telehealth business. So next, after you embraced it, you have to think about the next phase of this. So recently, I had a call from a potential client that commented he was competing not only with other doctors for his telehealth services, but with hospitals, large telehealth companies, and even retail companies like CVS. The challenge of trying to differentiate in this crowded market was a real concern for him. So how do you, as an independent practice, going to grow your medical practice in telehealth in this increasingly busy, crazy market? Here's a crazy solution. Instead of doing more, why not think more? So what do I mean? When I was younger, I used to work with my grandfather in his contracting business. We would go out and spend long, hot summers working on houses in this small town of Pembroke, Illinois. It was tough trying to follow him around. He was in his 60s, and here I am, a teenager, trying to keep up with him. Very difficult. I used to hate this work. Sometimes I would be on the roof of the houses to hammer roofing tiles into the frame. I would spend 10 minutes on each tile trying to nail in 5 nails per tile. It was hot and there were a lot of tiles to hammer in. I just figured I'd just keep hammering. The harder I hammer, the faster I hammer, the faster I get done. When my grandfather saw what I was doing, he told me to stop and think about what I was doing. Because the tiles sat on top of each other, 2 nails were enough to enable you to make sure they laid into the frame of the roof. So simply thinking about what I was doing saved me time, effort in the long run. So currently doing what you have been doing will not get you to the next level if you are a provider of telehealth services. The only way to position yourself in this crowded market of telehealth is to think more about how you can offer more value to your patients. For example, beyond just offering healthcare access to your patients with telehealth, think about what other things you can do to solve real problems for them. In some cases, this could be things like managing weight loss or diabetes management. For example, why not offer more value to solve that particular problem? If you're looking at diabetes management programs, why not help them build a diet plan to ensure that they eat healthy and keep the diabetes in check? Also offer remote glucose monitoring. That would be something unique for your patient population, especially if you can get the results they're looking for. And in this case, this would be lower A1C levels. So ultimately, as a telehealth provider that's looking to change in this new market, you can control and absolutely embrace these changes for your telehealth business by simply thinking more about the new opportunities that exist all around you. My company SynsorMed offers to help telehealth providers who are looking to embrace new models of care like remote monitoring with our new Practice Value Creator program. To learn more, check us out at practicevaluecreator.io. That's practicevaluecreator.io today.